Hello, this is my review of my medical kit. This is a medical bag purchased from Blackhawk.com. Actually, I got it from Amazon.com. I think it was like $32. It's canvas, I believe, like this thick canvas-like material. Velcro straps, the whole 9 yards. I like it. It seems pretty tough. And just kind of roll it out here. And of course the price I paid for it didn't include everything, but I like it. It has like the plastic windows, so you or whoever's administering aid can see the supplies. This is a disclaimer here. I don't take responsibility for your actions. I think information you obtain over the internet or just anywhere should be a reliable source. I'd stay away from like Wikipedia, and that's not really a medical journal, and anyone could really write one of those pages. Even people on the internet, YouTube, some nurses and docs, I mean, you really don't see their credentials. Or someone might be a chiropractor, they're a doctor, and are they really qualified to talk about trauma or first aid? Maybe. But in any event, here we go. My kit. This first window here, I have basically it's Mastisol and Steri-Strips. Mastisol, you kind of break it. I think I have some Dermabond there too. Dermabond is kind of like a safe super glue to use, medical super glue, if you will. You put it around the wound and it'll close it up. Mastisol, you put that around the wound, it makes the skin very tacky and sticky, so the Steri-Strip adheres better. And I've worked at several ERs and I've never seen super glue actually used to seal a wound. I heard from someone else that it's potentially carcinogenic. I don't know about that, but I've never seen it used. Usually use Dermabond or like I said, Steri-Strips and whatnot. Here we go here. I have some Neosporin and some hydrocortisone. The hydrocortisone, I like it. You can use it for bug bites, for the itching, poison ivy, irritation of the skin. Just it's like an anti-itch lotion. I also have some burn gel in there. It was from a different first aid kit, and it said something like a sunburn gel. And I looked in the ingredients, it was lidocaine, actually, like a topical lidocaine. So I just have that in there. If you just sort of want to numb the skin up, you can use that. And I put everything in basically these thick Ziploc type bags. I got them from REI, very thick. I like them. But so you don't have to really dig and try to get something out. You can just grab the bag and pull everything out, and much easier that way. Here I have about 6 pairs of gloves, non-sterile gloves, but just if you've ever used gloves or doing wound care or anything like that, you put a pair on, they get dirty, you take them off, and so and so. And then also, obviously, if there's something substantial and someone else is helping too, I have enough gloves to go around. I don't have a vacuum sealer, so I put them in a little Ziploc bag and kind of squashed it with a heavy book and then sealed it, and it worked pretty well. Here I have some sterile water. It's like an eye irrigation kit, but it's only like maybe, I don't know, 50 mils of water, so it's not very much. And I didn't want to put a bunch of water in here and take up a lot of room. But it was USN ER Doc. He basically, on one of his videos, made an irrigation kit out of bottled water. You just poke a couple holes in the top and just turn the water bottle upside down. Just water like Aquafina, something you buy at the store, and squeeze it over the wound or in the eye and irrigate that way. And I usually have a 24 pack of water in my trunk at all times in case my car breaks down. I live where it can get pretty warm, and I have that. So what I did, I got one of those caps, I poked some holes in it, and I took it out, and it's in this bag. So if I have bottled water with me or someone, you can just put the cap on and boom, you can start irrigating. The other thing here is glucose for insulin reactions. If you know a diabetic who is having blood sugar issues, you can give it to them. This takes up a lot of space. I'm going to get some gel actually, because if someone's pretty lucid and they really don't have the ability to chew, you don't want to stuff something that could compromise their airway. But gel, you can just kind of squirt in their mouth. And as far as diabetic issues as well, if someone hasn't been taking their insulin, or they're sick or on steroids or something, maybe they're not controlled so greatly, and there's a potential that they're hyperglycemic, obviously wouldn't give sugar. But maybe you're with someone, they're fine one moment, and then they've been getting a lot of exercise, maybe they skipped a meal, they gave too much insulin, and they start acting almost like drunk or very confused. You can give them some sugar. Don't negotiate with them. I'm a type 1 diabetic. I can get a little bit defensive. Sometimes people will start talking to you, like coworkers, hey, you need some sugar, hey, and try to ask you questions that you can't respond to, and then they get upset and kind of get in your face, and just break out your candy, some sugar, put it near their mouth, boom, they'll eat it. And but whatever, sugar, good to have. Here I have a vast supply of band-aids, all different sizes. I put them in these little Ziploc bags, and I peeled the band-aid off and put it on the bag cover, so I don't have to read and try to figure out what's what. I also have some moleskin in here too, for blisters, good to have. And I don't feel like digging things out, but I saw this at the store. It was like $1 or $2. Clean hands, basically, like a little towelette. Clean your hands when you're done, or before doing care. I have some Tegaderm down there too. If you've ever had an IV, you know what Tegaderm is. It's the clear, breathable sort of material, but it's waterproof also. It's good for like skin tears and whatnot. It's just a different option to have. It doesn't work so well on me because I have rather hairy arms, but Tegaderm, good stuff. Here I have a bunch of 4x4s, some non-stick and pads, good for like abrasions or something like that. Something kind of not really bleeding too much. You can just throw some bacitracin on it and throw it on the wound and cover it. You could tape it up, or you could use, boom, this over here, Curlex. Curlex is good stuff. It's absorbent. It's basically like these sponges, but like a long sheet, if you will, 4 inches by like 30. You could put several of these, on the arm or whatnot if it's a big abrasion, and then just kind of wrap it with the Curlex to hold it all together. And the Curlex absorbs fluid also and drainage. It's called Surgicel. It's kind of like a little screen with it basically will clot wounds. It's rather expensive, and I just sort of obtained it. It's good for head lacerations. The head's very vascular. Someone gets a little cut, even if it's not arterial, it can just bleed like crazy. You cut a piece off, or you just kind of stick this in there, it'll clot it up. It's pretty good. These are abdominal pads or ABD pads, whatever you want to call them. I just call them abdominal pads because you usually see them on someone's gut after like a surgical wound or whatnot. They absorb fluid. I have a bunch of these in here. I think I have 3 in each. Like I said, I put them in a Ziploc bag, kind of squashed it, sealed the bag, got rid of a lot of the air, and good stuff. You can use maxi pads also. A box of 10 of these cost me about $5.50. The maxi pads, I think I got like 36 of them for $3. The maxi pad, the packaging, they're maybe like 3 inches by 3 inches, but pretty thick. These are a little bit longer. I thought these fit in my bag a little easier. here's an ace bandage. You know, you can wrap a knee or an ankle. You know, someone sprained it for support. When you wrap, you always want to wrap distal to proximal, meaning if it's, you know, the knee that someone injured, you start below the knee and you wrap up towards the heart. It promotes venous return back to the heart. This is an Israeli bandage. It's kind of like you can use it as a tourniquet, but it's sort of almost like an ace bandage with like a clotting pad on it, used for, you know, wounds that aren't rather large wounds, if you will. And I will say, as far as bleeding, I don't have any clot busters in here really. You know, the Surgicel, I suppose, but pressure and elevation work very well. I will say that. And we'll just stop there. But if they don't, boom, I have a tourniquet here, like a cat tourniquet. This, the Curlex I spoke of, it's very bulky, so I took it out and I put it in a Ziploc bag. It's clean, you know, and people might say, oh, it's not sterile, you know. Well, it's clean. I'm not going to be doing sterile dressing changes, and I don't have any sterile equipment in here as far as, like, you know, scissors that went through an autoclave, or, you know, surgical gloves, or, you know, a surgical prepped area where I can, you know, do something very sterile. No, I don't need it. I got these little pill containers at REI. They're awesome. I think they were like 50 cents or something. The pills I have Lamodal. You know, it's an anti-diarrhea. I have a lot of those because when you have an episode of diarrhea, you take 2 pills, and then 1 pill after each additional bout of diarrhea. You can take up to 4 a day. Well, you know, if some water's tainted and you're with some people, you know, several people might get the, you know, diarrhea, so, and they don't really take up much space, so that's that. I have aspirin in here also, chewable aspirin, 81 milligrams. If someone has chest pain, have them chew on 4 of those. I don't recommend the enteric-coated aspirin because it gets absorbed in the stomach, and you don't get a lot of the drug. You know, the regular aspirin, like the chewable, is very acidic, and your stomach's acidic, so it actually, you get more of the drug. It gets absorbed in your stomach rather fast. The enteric-coated, it's safer on your stomach if you have ulcers, but like I said, you know, it gets absorbed into your intestine, and you don't absorb a lot of the drug. But in any event, that's that. Good for chest pain. It is an anti-inflammatory as well, but, and what else do I have? I have Motrin, you know, for pain. I have a loratadine, or like Claritin, for allergies, you know, hay fever, seasonal allergies. I have Benadryl for itching and allergic reactions, and Pepsid. They're both histamine blockers, different types. You know, and the Pepsid, you could actually use it for heartburn and whatnot. Heartburn, like upset stomach, if you will. But Pepsid, you know, people come in the ER having an allergic reaction. We usually give, you know, 50 milligrams of Benadryl and 20 milligrams of Pepsid IV, but we give it by mouth as well. We also give like Solumedrol, a steroid, but that's not something I really have in my kit here. In any event, those are those drugs. The yellow stuff, it looks like Vicodin. It's not. I don't carry any narcotics in here. You can get into some serious trouble if you're handing out your narcotics to someone else, or if you have narcotics and not a script for them. What these are, it's Jet Alert. It's caffeine, and why I have it is if someone's having an asthma attack and they have no inhaler, caffeine acts as a bronchodilator. So, you know, let's say you're, I don't know, at the gas station or something, someone's having an asthma attack, you know, give them 4 Diet Cokes and have them, you know, chug the Diet Coke, you know, get their caffeine level up, and it'll help bronchodilate them. You know, if the asthma is very severe and they need to go to the ER or something like that, you know, at least the caffeine will, you know, hopefully dilate their bronchioles a little bit until they can get like a neb treatment or something. But So here we go. This last kit over here. I have some Coban. It's very sticky tape, if you will. Well, it's not very sticky like a Band-Aid sticky. This adheres to itself. So you could use apply pressure. You could put some 4x4s on a wound and wrap it with this to apply some pressure. Good stuff to have. Silk tape. My batteries are running low, so I got to hurry this up. Silk tape. It's good after you put an ace bandage on. Put a couple pieces of this. It's very strong. Good stuff. This clear tape. Good stuff to have also. I need a carabiner, and I can, hook these onto the external part of the bag so they don't take up much space in here. Or you could get like put some hemostats through this and have clamp the hemostats on the handle and have all that available. 14 gauge IV or angio cath, 2 inches. Paramedics will know what that's for. I'm not going to go into it because you shouldn't be doing a needle decompression if you're not trained. These are tongue depressors. You can use it to like kind of butter Neosporin on a wound or something. You can make a little splint with it, or you can kind of check the back of someone's throat, if you will. I do have a pen light somewhere around here. That would really just be, hey, your throat, okay, you got strep, you need to go to the doctor or something. Not like that's really a first aid issue, but in any event, a scalpel, good to have. I actually know a doc who was at the scene of a motor vehicle accident, and someone lost their airway, and he had a blade in his car, an actual sterile blade, and trach someone out in the field and save the person. Pretty cool, huh? These trauma shears, cutting people's clothes off. I like the plastic ones a little better because you can fit many fingers in, but these just take up far less space. And then I have these scissors here. I need to put some like tubing over the end or something, so it's not very sharp. You can use it to debride a wound. That's it with the first aid kit. I took apart one of my other first aid kits to kind of build this one, and there were some ammonia inhalants. It was a very old first aid kit. I don't add them. I've never taken a trauma course or any sort of course where they recommend doing that. You put it under their nose and you wake someone up. Let's say someone faints and they lose consciousness. Maybe they've hit their head on the way down or something, and someone's kind of out. You don't want to. You want to protect their cervical spine. You don't want to wave something under their nose, and perhaps they have a neck injury and they move their head away from the strong odor. I think that's kind of contraindicated. I've never seen it taught anywhere. I've taken TNCC, ECRN, PALS, ACLS. I'm CEN certified, and I work at a level 1 trauma center. I've worked at 2s and 3s also, but in any event, I've never seen the practice done. If anyone out there knows if that's still, I think that's just old school medicine. But in any event, I'm just kind of rambling here. Here's a first aid kit. It's pretty awesome. I like it, and thanks for watching.